hey, they have a drug that treats Omicron, or COVID, except doesn't really do anything for people who are 40 to 65 years old. It turns out it will help give you a rebound infection, but it won't really. This is real. There's no benefit, little or no benefit for younger adults, while still reducing the risk of hospitalization and death for high-risk seniors. So, yeah, so this is the Barrington Declaration. The Barrington Declaration, which Fauci killed and then discredited those doctors who said what we should be doing is targeted lockdowns and targeted vaccinations. That's what the Barrington Declaration was. You have to, the most vulnerable, you protect them. That's what it sounds like. So while the risk of hospitalization and death are death for high-risk seniors, high risk. Who's at high risk? Seniors. According to a large study published Wednesday, the results from a 109,000 patient Israeli study are likely to renew questions about the U.S. government's use of Paxlovid, which has become the go-to treatment for COVID-19 due to its at-home convenience. The researchers found that Paxlovid reduced hospitalizations among people 65 and older by roughly 75% when given shortly after infection. Boy, wouldn't you like to look at the real numbers about all that?
Yeah.
The real numbers really they reduced it by 75%. How do you know? That's consistent with earlier results used to authorize the drug in the U.S. and other nations. But people between the age of 40 and 65 saw no measurable benefit, according to that's right. The study has limitations due to its design, which compiled data from a large Israeli health system rather than from enrolling patients in a randomized study or a control group, the gold standard for medical research. The findings reflect the changing nature of the pandemic, in which the vast majority of people already have some protection against the virus due to the vaccination or prior infection. For younger adults in particular, that greatly reduces their risks of severe COVID-19 complications. Oh, yeah. Because you know how kids were at such a great risk from COVID-19. Thank God you've gotten something to reduce their risk. The Centers for Disease Control and Prevention recently estimated that 95% of Americans 16 and older have required, so they've all gotten it. They've either gotten the virus or they've gotten vaccinated. 95% of Americans. Paxlovid will remain important for people at the highest risk of severe COVID-19. Yeah, such as 90-year-olds with fucking high blood pressure, a bad heart, and dementia. You mean 3 or 4 comorbidities? Yes. Why are they treating everyone like we're 94-year-old people? We're not.
If they start using this stuff on horses, I'm going to be really offended.
For the vast majority of Americans who are now eligible, this really doesn't have a lot of benefit. The Biden administration doesn't care. They spent $10 billion buying Paxlovid.
That could have went to Ukraine.
A spokesman for Pfizer declined to comment. The U.S. Food and Drug Administration authorized Paxlovid last year for adults and children 12 years and older who are considered high risk due to conditions like obesity, diabetes, and heart disease. More than 42% of U.S. adults are considered obese.
Jeez.
Did you know that?
Obese is surprisingly not as fat as you would think it is.
But it's still fat.
It's obese. That's what it is.
The FDA made its decision based on a Pfizer study in high-risk patients who hadn't been vaccinated so they did a study on how well Paxlovid worked, and they got high-risk patients, like people with comorbidities, people who are old, and people who weren't vaccinated, and then gave it to them. Well, that doesn't really, does that make you feel like they tested it on people like you?
You got mad when they did mice, and now you're mad they did it on...
So these people who are high risk and haven't been vaccinated, those people do exist, but they're relatively rare because most people now have either gotten vaccinated or they've gotten infected.
Thank you very much.
Thank you very much. So that test for Paxlovid on these people who don't have any of that, you can't extrapolate now because most people have been vaccinated or have gotten it.
I mean, they run these studies about as well as a Mississippi water treatment plant.
No kidding, right? So Pfizer reported earlier this summer that a separate study of Paxlovid in healthy adults, vaccinated and unvaccinated, failed to show a significant benefit. So if they tried it on healthy people, it didn't work. If they tried it on 90-year-olds with 4 comorbidities, it helped them. Those results have not yet been published in a medical journal. Isn't that interesting? More than 3.9 million prescriptions for Paxlovid have been filled since the drug was authorized. A White House spokesman on Wednesday pointed to several recent papers suggesting Paxlovid helps reduce hospitalizations among people 50 and older. That study has not been published in peer-reviewed journals. Administration officials have been working for months to increase use of Paxlovid, opening thousands of sites where patients who test positive can fill a prescription. That's what they're doing. They're not going and cleaning the water in Flint or Jacksonville or not. They're making sure people can get big pharma products. The administration are opening up sites where people can go get the big pharma medicine.
For months they've been on this.
For months. Last month, U.S. officials further expanded access by allowing pharmacists to prescribe Paxlovid. Wow. Artist rendering of Pfizer spokesman. I'm rich, biatch. Hey, we're coming to Tulsa, Oklahoma City, Detroit, Los Angeles, Spokane, Tacoma, Denver. Go to jimmydorecomedy.com for a link for all our tickets for all our live shows. See you there.